أما الآن نبدأ إن شاء الله مع العرض الأول والخاص بالأستاذ إبراهيم الدهيني. أستاذ إبراهيم، هل أنت
نعم سامعك
معنا؟ جيد. أستاذ إبراهيم، بإمكانك البدء الآن. تفضل أستاذ، الكلمة لك.
نعم. مشي حال البرزنتيشن وصلت؟ بينت البرزنتيشن عندكم؟
جيد، بينت. الصفحة الأولى عندنا، الصفحة الأولى
بينت. صباح الخير. نعم صباح الخير جميعا. يسعدني أن أشارك بهذا المؤتمر أونلاين مع زملائي في الجزائر وزملائي في الوطن العربي والعالم. بادئ ذي بدء. I would like to congratulate and say happy International Day of Medical Physics for all the physicists and those who are working in the front line for the sake of the profession. Today, this year theme is the medical physicist as a health professional. And from this, we have decided to get this logo or this poster to reveal that we are all hands in hands for the safety, for the therapy, for the diagnostic of our patients. And especially in this COVID-19 pandemic, medical physicists are trying their best to make sure that the patients are taken care of, even though some of them have COVID-19, with a bit of precautious and understanding the principles of healthier and hygiene. Today's topic I chose to be radiation safety in pediatric imaging for the sake that pediatric imaging now it's becoming more and more worldwide, and because of the pediatrics are a great concern for their healthy and safety. So this is my content. I hope that you can see everybody. Pediatric radiology involves imaging those with a disease of childhood and adolescence. These children, they undergo examination, they require special attention. Why? Because they have a specific disease unique to childhood. Also because of the age-appropriate care that should be performed during the exam. There are many in the news concerned about the images of children, especially the CT scan. And many of the physicians around the world, they don't have enough information, let's put it this way positively, that the CT scan could be very risky to the kids, especially if there is other alternatives. That's why we have a lot of concerns in the media about the safety of children, because there were a lot of sources that they are linked to cancer. So why children? Why? Because children are a special concern in radiation. They have higher radiation sensitivity, their cells. They have longer life expectancy, and because the identical settings provide higher organ dose than the adults. Therefore, kids are more susceptible to radiation damage than the adults. What can ionizing radiation do? As most of you know, and a lot of physicians, that the radiation exposure could do possible harm and different severity of radiation effects. And these combination of probability and severity, we can call them determinant. So these determinants can cause a high dose to the organs, and this could increase the risk of radiation-induced cancer in later life. Because of child, we said that they have longer life expectancy. So what are the two types of radiation effects? As a revision, we have two types: deterministic effects and stochastic effects. What are deterministic effects? Deterministic effects are those who can go through the chain of interaction from the energy absorptions to the change in the DNA, to the biological repair, and to the cell death, that could promote or show on the organs the deterministic effect. These are clinical changes that we can see. On the other hand, the stochastic effects are the long-term effects that we cannot see directly on the patients, but it could be linked to a cancer or heredity effects. So the deterministic effects have their severity. The higher the dose, the higher, the severity. And the deterministic effect to occur, there should have a threshold value. Above this threshold, the effect can be seen. Example of deterministic effect: skin reddening, erythema, tissue necrosis, epilation, hair loss, cataracts, blood abnormalities, disease in sperm production, and in males. So these effects we can see directly on the patients. And as we said, the severity increase as the dose increases to a threshold value. What are these? Whereas the stochastic effects are random effects, they are not linked to the amount of radiation, which means that any amount of radiation exposure could lead to stochastic effects. And this could be linked to cancer and hereditary genetic effects. So the radiosensitivity for the kids, they have highly mitotic and they are undifferentiated cells. That's why children are very radiosensitive to radiation. So there are many models that depict the radiation for pediatric, and the latest model, they assume linear no threshold model, which is internationally agreed upon the most appropriate dose response relationship for radiation protection purposes. There are sound biophysically arguments supporting the LNT model, which means that the higher the dose, it has like with the dose on the axis and the percentage of risk. So they go linear, especially with young children. So the progress of the radiation models, which means that we do not know if the low-level example, the CT, medical radiation increases cancer risk, but we should act conservatively to lower dose to be safe. So again, the ALARA principle is very depictable here. So the low level of radiation could not be linked to cancer in one way, but at least there are some studies they show that there is a link. So to get the lifespan studies, determinant adjustment nominal risk coefficient, they reveal that 5.5% risk per sievert of absorbed dose for the whole population. This is according to the ICRP 103. So this is the percentage risk per sievert of the absorbed dose. And as you see, it is a number that can be a high, a big number. So to compare the children mortality excess per sievert, as according to the Bayer report, we can see that at younger ages here, see the probability of mortality excess is higher than at higher ages. Why? Because as we said, the cells for the children are more sensitive, and because of the higher lifespan, so they will be exposed to more radiations during their lifespan. That's why the younger generation, they have a higher mortality, and we can see that female are more risk than the males. Here are some radiation risk in pediatric radiology. So if we can take the examinations for the chest PA, the effective dose is around 0.01 millisievert, which have a lifetime risk of fatal cancer 1 over a million. So as we increase the dose with the different modality, and we reach to the CT of the body, which gives approximately 10 millisievert of effective dose, the lifetime risk of fatal cancer increases to 1 over 1,000, which is considerably a high number. So the risk associated with the chance of developing a fatal cancer from radiation exposure in children is higher than in adults. So how can we control the risk? So the kids they don't know nothing about what we are doing for them in the X-ray. So they want us especially the professions that dealing with the radiation, to take care of them and to lower the risk. How we can do that? We are using the objectives of radiation protection, as simple as that. To the prevention of deterministic effects and the limiting of the probability of the stochastic effects. And we know that we cannot prevent the probability of stochastic effects, as we said, because there is no threshold in one sense, and plus that there is studies that any exposure to radiation could lead to stochastic effects. So what are the basic principles of radiation protection? As we all know, we have the justification, optimization, limitation. No part should be taken as separate. So what is justification? The justification is that we have to study the benefits that should, when we do the imaging for the kids especially, must be greater than the risk. While optimization is we have to keep the doses as low as reasonably achievable with the ALARA principle, and limitation is to limit the dose and not to exceed the dose limits specified by the protocols. So again, how to help us in the justification? These are some of the tools that we could be used for the justification purposes. The use of evidence-based referral guidelines and local protocols, and this could be done by the latest technology and the recent studies, which they refer to new guidelines every time that we have the risk. Use of clinical audit of justification, including appropriateness of examination, and this could be done by exchange ideas among physicians about the purpose of the imaging. So examination will only be conducted when appropriate and necessary. That's the first one. And second thing we can do, other alternatives like using ultrasound and MRI, especially if these could help more in the diagnosis of the disease. And again, we have to pay attention to previous procedures, which means that if a child comes to the X-ray department, we can ask their parents if they have done these images in other centers, especially lately, so that we can use these images instead of redoing the images again. So that could be a good hint for the radiology departments to take into consideration, not for the profit of making the diagnosis in that new center. So to make sure that the ethical medical ethics is played a role here. In the optimization, what we can do is increase the education and training for those who are involved in imaging of children, especially the referring physicians, just to make sure that they know the effect of radiation and how can we decrease the radiation exposure, especially to children. And second, we can use international standards, especially that the equipments now, they are specific for children. We have CT specialized for kids now, X-rays, so they have lower output for the imaging purposes. Also, a team approach should be taken into consideration, and also the size of the kid should be taken into consideration. The limitation could be as radiation workers, we can tailor the examination parameters to size of the child to use minimal possible amount of radiation to indicate image only the indicated area and avoid repeated examinations. So what are the guidelines for pediatric imaging? Here are 7 guidelines I will pass through fast that will help radiation departments, radiology departments use these guidelines, especially if they have a high population of kids getting exams. So especially in there are now specialized children hospitals. So in these children hospitals, of course, there is the radiology department is mainly will be done for the children, and these guidelines are very helpful that we can use in the patient preparation, for example. So we can prepare the radiation room to be very friendly to the kids, because if they see these animals, these cartoons, they feel comfortable, so they will not, you know, panic, or they will not move a lot. So posters and pictures of children that make them relax, so it will be easy on the technical staff to make the diagnostic imaging. The careful and supervised sedation and anesthesia policies should be in place, and their application requires special training. Then this is another issue, that if we can have some kids that they are very energetic, so we need, you know, sedation in this purpose. So we need anesthesia team to be on site, ready to be to take care of the sedation, give them the proper amount of sedation so that they can wake up after the exam. The environment of the radiology department for the kids should be also friendly for the kids. Some cartoons, some animals, so they feel like they are in a place that they would like to come every time. So the decoration can affect the you know, sensitivity for the kids to be cooperative. Immobilization devices are very important in the kids, and there are many, you know, companies that they have specialized immobilization device, because as we know, kids, they cannot stay still for some time. So we have to make use of these immobilization devices. Their usefulness should be explained to the accompanying parents, because parents could help a lot the technical staff in holding their kids tight. And of course, if the parents are going to be in the room, we should, you know, instruct the parents about the proper use of the shielding devices for them, to protect them and to be as far as possible from the radiation source and from the patient. So immobilization could be, we use some toy things could be used, and these toy could be used for immobilization instead of the regular immobilizations that we use for adults. These are some examples of immobilization devices. You know that the most important thing about these immobilization devices is that the kids will feel comfortable, you know, while doing this, and we make sure that there is nothing that they can hurt them while they're doing the examination. And you can see here the parents with the lead shield is holding their kids, and that's an important aspect to make sure that the kids are you know, they feel comfortable without worrying about the imaging. Again, these are some shielding devices specialized for, you know, the pelvic area and for the chest, with different sizes. This is one size does not fit all in the kids, you know, parameters. So we have to make sure that the immobilization devices or the shielding materials, they fit the kids, and we know that the kids could be, you know, in different sizes. So these are some notes to the parents and the comforters and the carers. As a general principle, parents or family member should support the child during any radiological examinations. Why? Because the child feel comfortable that their parents are inside the room. Otherwise, we could be very difficult to hold still the patients on the table. Also, they should be provided with appropriate shielding and instructions. Radiological staff members should only hold a patient under exceptional circumstances. Even in quite young children, the time allocation for the examination must include the time to explain the procedure, not only to the parents, but also to the child. Some child, you know, it's better to tell them, you know, to hold still for a certain time, so that we can give you some, you know, toy, we can give you some cookie or something, so that to encourage them to stay still during that time. These are some guidelines from European, from imagegently.org organization, some brochures for the parents and how to deal with, you know, diagnosis for the kids, especially the CT scan. So these are, you know, informative brochures that can be found online for the family to help them in the process. Again, education and training are one of the most important aspects for the radiation safety, and we as medical physicists, we should be the one who, you know, be involved with these education and training for the technologists, for the physicians, and for those who are referring for diagnosis imaging. So we should take into consideration radiological techniques involved and also the radiation protection principles. We should have specific training for different physicians, and we should always continue professional development for all the staff. So these are some technical parameters that could be used for good radiographic techniques for children, you know, that patient position and these kind of that can be found in the European guidelines on quality criteria for diagnostic radiographic images in pediatrics. Again, another message for pediatrics with the SMART logo, Child SMART. And this is also for the parents and for the comforters to be aware of what we do as a technical staff. We use shielding appropriateness, we marking of the films, the ID, because in case that we have a wrong patient, we will not be able to, so that we cannot have a wrong patients. Area collimation, that's the ALARA principle, restriction of child motion appropriate using immobilization, and technical settings. This is for the shortest exposure time, KV up. So Image Gently for Kids is another campaign, you know, that will that is internationally recognized, so that we make use of these techniques for the sake of the kids, so that we can lower the possibility or the probability of any leukemia. By the end, I would like to wish all my colleagues around the world a happy Medical Physics Day, and I hope this year, with the end of the pandemic, hoping that we will find some, you know, the vaccines for it. Next year, we'll go face to face, so that we can celebrate, you know, better. Thank you very much for your listening.
Thank you so much, Mr. Ibrahim DUHAINI. Anyone have question? Please.
Yes. Yeah, the floor is yours.
Yes.
Abdel-Hai.
صالح بالي تفضل.
I would like to make it's not question by but a precision. The new CT scan offers a lot of possibilities to reduce CT doses to pediatric patients. So in the new facilities, we use less and less doses. So we can reduce by a factor of 10 now, since the first CTs and the actual CTs, we have reduced by a factor of 10 the dose to the patient, even in a full scan examination. What about
that's good. That's a good thing. And do you have the CT decorized as for the pediatrics? Do you have some cartoons in it?
No, because we have only one CT in our facility, so it's used to all patients. So we have not dedicated the department for pediatric examination. So the decoration is not for pediatric.
Maybe you can do that. Yeah.
Yes, but we use this decoration, and even in radiation oncology department, we use for masks, for example, we use some decoration for the patient mask and immobilization to make it like as Batman, or some things, some photos that children can enjoy, and the radiation course will be done easily.
Oh, that's good. That's good. Good job. Yeah.
Okay. Any other question? Please feel free to ask a question if you have, and profit. نقدم الفرصة على الأقل الأستاذ إبراهيم معنا هنا إذا كان فيها بعض الأمور.
دكتور إبراهيم، عندي مداخلة أخرى فيما يخص reducing doses. Are there in Lebanon or in Arabic countries some regulation for obligation of reporting doses for the patient from his first year to that he is adult or not yet in Arabic countries?
You are mute, Ustad Ibrahim, راك mute. Ustad Ibrahim, راك mute.
Okay. Just can you repeat the question?
Okay. I speak about the recording doses for every patient. I have seen in some countries like Sweden or Denmark, they have for every patient in his card, in his medical card, the records of all doses that the patient has taken in his life from his childhood, and we can see for every patient how many CT scan he have done with how much doses, and this can reduce the overall dose to the patient and reduce in radiation protection purpose.
Unfortunately, I will speak about Lebanon. We didn't use this technique yet, but we did some studies about the radiation dose in many diagnostic modality, X-ray, CT, and fluoroscopy. And also in mammography, in a study with the Lebanese Atomic Energy Commission, which is the regulatory authority, and we send results to the IEA. But this project, it's called the one card or the dose card, which could be very beneficial for the kids in this case, that will record all the X-rays done, any radiation done, and also will record the doses in this card. It's like a credit card. Unfortunately, we didn't have, and I didn't see in many of the our Arabic countries yet. But in Europe now, they are going with this technology, which will help trace the doses for the kids from their day of their examination. So this is like we use the TLD as radiation safety personnel. They use this card, the X-ray card or the dose card, for their lifetime, and that will be linked to the Social Security, which is the medical file. So then, when any physicians or see this, they can see, the radiation doses on them. So they can also predict if they will do, certain CT per the year. If they have done, like, for example, 5 or 6 CTs in this year with higher doses, then they can rethink twice before they impose another CT in this year. So again, yeah, that's a good technology that I think we should think of in our Arabic countries. Yeah.
Thank you, Dr.
Thank you.
Thank you, Salah Bali. Any other question, please? Other question? اوكي استاذ ابراهيم شكرا جزيلا. شرفتنا اليوم ان شاء الله. ربي يبارك فيك.
شكرا. الله يسلمك.
باذن الله ان شاء الله غيرك معنا ان شاء الله باذن الله. ان شاء الله.
ان شاء الله تعالى. تحياتي للجميع.
الله يسلمك.